विघ्नेश्वराय वरदाय सुरः प्रियाय लंबोदराय सकलाय जगद्हिताय नागाननाय श्रुतियज्ञ विभूषिताय गौरीसुताय गणनाथ नमो नमस्ते। कर्पूर गौरम करुणावतारम संसार सारम भुजगेन्द्रहारम सदा वसन्तं हृदयारविन्दे भवं भवानी सहितं नमामि। या कुन्देन्दु तुषारहार धवला या शुभ्रवस्त्राव्रता या वीणा वरदण्डमण्डितकरा या श्वेतपद्मासना या ब्रह्मा च्युतशङ्कर प्रभृतिभिः देवै सदा वन्दिता सा मां पातु सरस्वती भगवती निःशेषजाड्यापहा। सर्वमङ्गलमाङ्गल्ये शिवे सर्वार्थसाधिके शरण्ये त्र्यम्बके गौरी नारायणी नमोस्तुते। आविर्बभूव कलशं दधदर्ण वाद्यः पीयूषपूर्ण ममरात्वकृते सुराणां रोगजालजीर्ण जनताजनितः प्रशंसो धन्वन्तरिच भगवान् भविकाय भूयात्। श्री धन्वन्तराय नमः। ओम शांति ओम शांति ओम शांति। Namaskar. We would like to welcome you all on our 1071st webinar with blessings of Dr. Shantala Priyadarsani ji, under guidance of Sri His Excellency Sri Tanmaylal ji. With his support, we are really thankful and grateful to Embassy of India for Sweden and Latvia, and especially its leader, our ambassador, beloved ambassador, His Excellency Tanmaylal ji. I am grateful to Dr. Shantala Priyadarsani ji for coordinating everything right from speakers to the embassy. Thank you very much, madam. And now, with your blessings, we are celebrating Ayurveda Day with Latvia. Congratulations to all Latvia experts who are going to join or who will be watching on YouTube. So now I would like to request Dr. Shantala Priyadarsani ji for his preamble.
In 2 minutes, I will be speaking about the program today. When we wanted to plan a Ayurveda Day, we thought bringing everybody together, people who all matter, people who can give guidance, support, career guidance, like what you have been doing so far and what you can do later. This is the best day to start with blessings of Dhanvantari, and this is the best platform to start Ayurveda Day. And so I thought I will be bringing in people, youngsters who are achieving a lot and who have been achieving and who have already achieved. And I will be bringing for the opening remark our ambassador. Ambassadors are usually called His Excellencies. So I was wondering why. And after I met our ambassador, I saw, yes, he is excellent in everything. His speech, his way of speaking, and everything. So it is actually, they have very superior knowledge. They have at least 2 degrees first, and then the IFS, and then they are given a training, and they know how to convey their best thoughts and time sense. Everything is so superior. So that's the reason why they are called, addressed as His Excellency. So today I would be playing his recorded message. He was very kind enough to send us his recorded message. I will be playing that first, and then
Put a tick on two boxes. When you share, put tick.
sir, did I connect?
No, it is shared, but where you have put two ticks. No, you have not put two ticks, madam. I am communicating again. Please stop share. Kindly stop share.
Now you are able to see the ambassador's photo.
I am we are seeing ambassador, but we will not be listening him until and unless you will check two boxes there. When you are sharing it, again share. Stop share, please.
So now,
No, no,
now it has
stop
come up.
share. Stop share first. Please stop share.
Okay.
Yes, now try to share again. One box will be coming. One
Yes,
window
yes.
is coming.
Yes,
No,
now
no.
you are able to see.
Oh, please stop in the between process. Stop share, madam. Now try to share. One box will be, window will be coming. And in that window, two boxes are there.
So now you are able to see.
We are able to see right from the beginning.
Okay. Are you not able to listen?
We will not be, because if you will not check those boxes, we will not be able to listen. First try and stop at first step of that. Screen. Screen is written there. So select screen. And then two boxes are there. Optimize for video and audio. Two boxes. Please put tick in that box. Please put tick. Very easy. Very easy. Your screen is visible.
Now we are able to hear, sir. Now
No,
we are
no.
able to see.
Start first as we are able to see.
No, sir.
Have you put tick on that? Two boxes are there, madam. If you will try to share, one window will come, and at that window, in the last, see the bottom of that window, two boxes are there where you have to put tick on the both the boxes. Optimize for video and optimized for audio.
Sir, now you are able to see?
We are able to see right from the beginning, madam.
Okay.
We are not able to listen, and we will not be able to listen until and unless you put tick in 2 boxes.
Which 2 boxes, sir? I am not sure what is happening.
Stop share. Stop share.
Okay.
Then try to share again. Don't do final stage. Try to share. One window is come.
Share.
One. Don't share. Madam, don't share. Stop share, please.
Okay.
हाँ, वो शेयर का बटन नहीं दबाना है जब तक हमको 2 उसमें बॉक्सेस में टिक नहीं करना है. टिक करना है फिर बटन दबाना है. आप देखिए, आप शेयर करने का आएगा तो आपके पास एक विंडो आएगा. उस विंडो में स्क्रीन भी लिखा है, जो विंडो में खुला होगा वो लिखा है, और उसी में 2 बॉक्स है नीचे, चेक बॉक्स, ऑप्टिमाइज फॉर वीडियो एंड ऑडियो. तो बस उस पर टिक करना है, क्लिक करना है, टिक दोनों में.
ओके सर, अभी
स्टार्ट कीजिए.
Me to join you on this year's Ayurveda Day.
Excellent.
The theme for this year is Ayurveda for One Health. The traditional and indigenous wisdom has always inherently recognized the interconnectedness and interdependence of humans, other species, and the nature of which they are a part. It reflects this holistic understanding of harmony and balance at various levels. This understanding is also growing, especially after the recent disastrous global COVID-19 pandemic. The World Health Organization studies show that there is a widespread and growing acceptance and use of traditional and complementary medicine globally, including in Europe. Nearly 90% of the WHO member states, that is 170 countries, report the use of traditional medicine. According to the WHO, traditional and complementary medicine, TNCM, is an important and often underestimated health resource with many applications, especially in the prevention and management of lifestyle-related chronic diseases and in meeting the health needs of the aging population. It further notes that many countries are seeking to expand the coverage of essential health services at a time when expectations for healthcare are rising, costs are growing, and most budgets are either stagnant or being reduced. More than 100 countries have the laws to regulate the use of TNC medicine, and nearly 125 countries have laws to regulate herbal medicines. There are several well-established traditional medicine systems in the Southeast Asia region. Europe lags behind global averages in TNCM laws and regulations. However, even in Europe, there is a marked increase in the number of member states with a registration system and regulation for herbal medicines, and 45 of the 53 member states report both of them. At the same time, lack of research data and financial support for research, lack of mechanisms to monitor safety of TNCM practices, and lack of education and training for TNCM providers are among the main challenges. India, on its part, is making available significant resources towards the promotion of traditional medicine within India and also globally. In 2014, a Ministry of AYUSH was created to promote traditional medicine systems. There are nearly 3,000 Ayurveda hospitals in India and 500,000 Ayurveda practitioners and physicians. There are 7,000 licensed Ayurveda pharmacies and 120 drug testing labs. There are 500 Ayurveda colleges in India. Last year, India hosted the Global AYUSH Investment and Innovation Summit. India is working for the inclusion of Ayurveda and related systems in the 11th revision of the WHO International Classification of Diseases, ICD, in the second module of the supplementary chapter of traditional medicine. As many of you would be aware, the WHO Global Center for Traditional Medicine is coming up in Jamnagar in Gujarat. India has committed funds to the tune of nearly US $100 million over the next decade towards this WHO Global Center. 2 months ago, India hosted the first WHO Traditional Medicine Summit. The summit focused on use of science, technology, innovation, and knowledge exchange to validate TNCM for improving health, nutrition, and lifestyles. Use of data and analytics and digital frontiers, including artificial intelligence, were discussed. The summit called for facilitating evidence-based and evidence-informed integration of TNCM into national health systems using a primary healthcare approach and to progressively realize universal health coverage and all health-related SDGs. In this broader global context, the AYUSH chair at the University of Riga forms a special bond between India and Latvia. This collaboration offers a unique opportunity to make a significant and positive contribution to the global efforts to move towards a more evidence-based approach to the use of traditional medicine. This India-Latvia collaboration is a unique example of SDG 17 that calls for global partnerships to advance other SDGs. In this case, the SDG 3 that aims to ensure healthy lives and to promote well-being for all at all ages. AYUSH-related market in India is estimated at $25 billion annually. India is exporting the herbal products valued at around $1.5 billion to around 100 countries. There are nearly 80 Indian companies with 6,000 AYUSH products that have received certification. Plant derivatives, nutraceuticals, pharmaceuticals, plant extracts, and herbal plants are all witnessing huge growth in turnover. We hope that experts from Latvia and India can work together to initiate and produce scientific research that can validate some of these Ayurveda treatments. By promoting scientific collaboration to examine the efficacy of Ayurveda in treating non-communicable diseases such as diabetes, this partnership has the potential to make a lasting contribution to help our collective goal to promote traditional and complementary medicine at global level. We wish you success in these efforts. Thank you very much.
Thank you, His Excellency, for your kind words. We are really grateful to you that you have supported us. You are supported in University of Latvia and Dr. Shantala Priyadarsini's concept. Really, we are grateful to you, sir. And please bless us like today, every day. Dr. Shantala Priyadarsini. Stop share. Madam, what would you like to do?
Yes, sir. I'm trying to stop share and come back.
Don't worry, I will do it.
Okay.
Yes, please tell.
Namaste, sir. We have been very grateful to His Excellency for giving this much awaited talk. And I hope youngsters who have been listening would be much motivated to work more, because he is speaking about how much of export is happening. What is the future? So the future is put in commercial aspects. So it means that youngsters should work much more for the future. So we are very grateful to His Excellency for giving this speech. Now we would be having from the people who are achieving something more in the field of from the Government of India. So we would be having the advisor of Government of India who would be speaking. So do you have any questions or any suggestions, or what I need to convey to His Excellency can be please given. So I will make a note of it, and then
it will be presented through chat box. If anybody has any suggestion, please write down to chat box. So our
and
continuation.
suggestions, any questions like you want anything more? Okay.
No.
So
No,
we'll
next
go
speaker.
to the next speaker.
Right.
We have to have
Same process. To tick and then share.
Hello, everybody.
You have stopped. Again, share.
November 10th this year, and every year this is being celebrated on the day of Dhanvantari Jayanti.
Sir, are you
Don't
No?
stop share. You are stopping share.
now you are able to hear him?
Yes, clear. If those two check boxes are tick. Yes, we are clearly listening him. Please continue. Please continue. Please share. Hello. अग्निहोत्री सर.
अभी आपने बताया था स्टेप बाय स्टेप, मैं तो कुछ स्टेप भूल गई. बिल्कुल चालू हो गया था, नर्सरी जी का प्रवचन शुरू हो गया था. मैम बिल्कुल आप सही चल रही हैं, बिल्कुल सही. आप वैसे पहले ऐसा करिए, आ जाएगा. एडवाइजर साहब का मैसेज शुरू हो गया था. अच्छा, आपको फोन कर रहे हैं. वो निश्चित रूप से कुछ प्रॉब्लम हो रही, नर्वस हो रही है, पहली बार कर रहे हैं इंटरनेशनल. तब तक हम लोग चर्चा करते हैं. मैडम की बहुत अच्छा चल रहा है. हिज एक्सीलेंसी साहब ने बहुत ही अच्छा टच किया एरिया को, आयुर्वेद का, भारत में भी ग्लोबल समिट की भी बात करी. मैम आप बिल्कुल वैसे ही करिए जैसे प्रोफेसर पवन शर्मा जी ने बतलाया था. एकदम से बिल्कुल सही आ गया था एडवाइजर साहब का मैसेज.
नेसरी जी की भी आवाज आ रही थी.
जी आगे शुरू हो गया था जी. आगे देखो.
Please start sharing, madam. Start sharing.
It is mentioned in one Sanskrit shlok. It is
Right from the
Pindam
starting again,
Brahmande.
please.
That is what is.
No, starting video. Share is share. You can click on video to convert to anything. Don't stop share.
थोड़ा बैक कर लीजिए, वहीं शुरू करिए जीरो से.
हाँ. Please share, madam.
Research has been found to be very effective against the COVID.
अग्निहोत्री सर देखिए ना.
वो लाल वाली जो एरो आ रही है उसको बैक कर दिए, जीरो पे ले जाइए. जहां से स्पीच शुरू होती है ना, उसको टच करके बैक कर दीजिए. बैक उसको स्क्रॉच करिए तो जीरो से शुरू हो जाएगा. जैसे वीडियो चलता होता है तो उसको हमें रीस्टार्ट करना होता है जीरो से. वो जहाँ रनिंग की वो लाइन आ रही है रेड वाली, उसको जीरो पे बैक.
Of the family welfare and the different.
हाँ, इसी कर्सर लेके बैक कर दीजिए.
Hello, everybody. This is
Yeah, good.
Dr. Manoj Nesri from the.
Yes, it was going well. Please don't stop. Madam Chair.
यही था, वो जीरो से शुरू हो गए थे. हेलो एवरीबॉडी शुरू किया था उन्होंने. एक शायद एक
Please share. अग्निहोत्री सर देखिए ना थोड़ा.
मैम आपका बिल्कुल सही स्टार्ट हो गया था. आप वहीं जो आपने प्रोसेस पहले किया था,
Pause is not good for webinar, madam.
just repeat the same which you have done earlier. The second speaker of today, Vaidya Manoj Nesari ji, his speech was started very well, right from the very beginning. So you please do the same process, and we will be in position to hear the message.
कुछ गड़बड़ है मैडम?
Same process करिए.
Share. Click on share. Please click on share, then two boxes tick, and then again share.
We have launched this
Yes.
initiative. In this
Okay, no
line, the
problem.
Ministry of AYUSH and the Government of India has
इसको back कर दिए.
joined
Please
hands
start with
with the
छोड़िए
various
ना सर.
ministries of the government, whether it is the Ministry of Agriculture, whether it is the Ministry of Veterinary and Animal Husbandry, whether it is the Ministry of the Health and Family Welfare, and the different ministries. And some of the initiatives taken is the huge number of plantation, the millions of plants and the different species of Indian origin. They are planted in the Ganga basin, and that is the project called as the Namami Gange. And likewise, we are also promoting the millets. We are also promoting the cultivation of the medicinal plants. We are also promoting the organic cultivation with the help of the various organic methods which are mentioned in Ayurveda. At the same time, we are also providing the medicines and the further diet and the nutrition to the animals, to the human being, to the children, to the women, to improve the overall health of the entire community, the entire ecology, including the plant and the animal. So this is the theme for the Ayurveda Day, and there is a lot of opportunity for the business, and that's why the government of India is also promoting the startups in these various areas, and will be happy to interact with all of you and to give you more knowledge about this. Please join hand with this on this occasion of 8th Ayurveda Day with the theme Ayurveda for One Health and the tagline Ayurveda for Everyone Every Day. Thank you.
Thank you. Thank you, Dr. Manoj Nesri ji. Thank you very much for your kind words. We are really grateful that you have spared time for University of Latvia and Independent Research Ethics Society. Thank you. Thank you very much. Dr. Shantala ji.
Thank you very much, sir, for not only sending the video and also for giving us very good information. Thank you very much.
Now we would like to welcome our third speaker of the session, Dr. Raghuram Bhatt. He has been kind enough to send us the video by sparing his valuable time, and he has sent us video. And then Dr. Valdis Pirax. So both of them has sent us video of their voices. Welcome. It is not shared, madam.
Why is it not being shared?
No, share again, share like that. Don't worry. Yes, yes.
This Ayurveda Day is Ayurveda for One Health or Ayurveda for Holistic Health, and Ayurveda for everyone on every day. It was our Honorable Prime Minister Narendra Modi ji's dream and proclamation that Ayurveda Day should be celebrated in a big way all over, not only all over India but all over the world, in order to propagate Ayurveda in the globe. Hence, the Kartika Krishna Trayodashi, that is the birth day of Lord Dhanvantari, who is the Lord of Ayurveda, is being celebrated as Ayurveda Day in India since 2016. Since 2016, every year Ayurveda Day was being celebrated, and this year Ayurveda Day will be celebrated in more than 100 countries all over the world. The objective of Ayurveda Day is to promote and disseminate Ayurveda at international level and establish it in the global scenario for the welfare of mankind, animals, plants and environment. Especially, the emphasis will be given to Ayurveda for students, Ayurveda for farmers and Ayurveda for public health. It is known to the whole world that Yoga Day is being celebrated on June 21st, and almost all the countries in the world are celebrating Yoga Day wholeheartedly together and spread the message of yoga for health all over the world. In the same way, Ayurveda Day should also be celebrated all over the world. All the people of people of the world should come together, as it is told by our Prime Minister Narendra Modi ji, Vasudhaiva Kutumbakam, the whole Vasudha, the whole earth is, the people living in the whole earth should be our Kutumba or our family. That is to be expressed in celebrating Ayurveda Day, and the whole world should come together to embrace Ayurveda for their maintenance of health as well as curing of the diseases. That's what is told in Ayurveda. The dual aim of Ayurveda is swasthasya swasthya rakshanam, aturasya vikara prashamanam. That is maintaining the health of the healthy and curing the disease of the diseased. Ayurveda is an ancient healthcare system. It was there in India since thousands of years, more than 5,000 years old, or even we can trace back to the Vedic era where Aushadha Sukta etc. are told, and Ayurveda is considered to be the Upaveda of Atharvana Veda. In Rigveda also many hymns say about the medicinal uses of plants. So it can be dated back up to 10,000 years as well. And Ayurveda is considered to be apaurushaya, and it's not a man-made system of medicine, but it is a God's gift which is being brought to earth by Atreya Bharadwaja. That is the Bharadwaja who has brought this into this earth and taught to Atreya and his Shishyas. Atreya has taught that to Shishyas. So Ayurveda is considered to be a divine healthcare system which is to be propagated now and which was in practice in ancient time and which was rendering the healthcare need of the whole country, not only the country, the whole world. All the medical systems have been evolved from Ayurveda, and unfortunately in India, due to the invasion of Mughals and English people and the propagation of this English medicine or allopathic medicine, the usage of Ayurveda has become extinct, but still there were, after the independence of India, Ayurveda was being supported. Many Ayurveda colleges have been established, and many Ayurveda practitioners, traditional practitioners, have continued the tradition of Ayurveda, like Ashtavaidyas in Kerala and the Brahaspati Dev Trigunaji in Delhi, and other such Vaidyas who have upheld the tradition of Ayurveda. And now we have more than 500 Ayurveda colleges all over the country, various national institutes like All India Institute of Ayurveda at Delhi and Goa, and National Institute of Ayurveda at Jaipur, in Banaras Hindu University at BHU, and many such institutions are imparting Ayurvedic educations, and more than 3 lakh practitioners are practicing Ayurveda. Every year, more than 38,000 of Ayurvedic doctors are coming out of the Ayurveda institutions. Such Ayurveda tradition is being continued by all these Ayurveda practitioners and Ayurveda academicians. Now there is a need to propagate Ayurveda among the people. People should understand the benefits of Ayurveda, know the principles and practice of Ayurveda, and they have to come to Ayurveda as their first choice of healthcare need. Then naturally Ayurveda will become the primary healthcare system of not only India but all over the world. For that, various programs like lectures, seminars, medical camps, survey programs, healthcare awareness programs, various competitions should be conducted by all the educational institutions and practitioners, Ayurveda lovers, and the Bharatiya citizens in order to propagate this Ayurveda among people.
Thank you, Raghuramji. Thank you for your kind words. You have really just metamorphosed the system of education, which will be beneficial for the society, students, as well as teachers, and ultimately for our IOS systems. Really, we are grateful to you. Thank you. Thank you very much again for your kind words. Dr. Shantala Madam. Please share.
other parts.
Put it through a purification process.
I can say in this small time.
Dr. Pala for speaking about all the challenges and strategies and raising awareness.
Adequate and it is appropriate through all the life
वो
cycle
कितने
stages.
मिनट पर था बस इतना
To
काउंट
the
हो जाता
elderly,
पहले से तो इजी हो जाता
means in childhood adolescence and for athletes, people like me. So this is the way to go, and when we look to the
एक बार
literature,
स्टॉप शेयर करके आप पहले निकाल लीजिए उसको
Papers are published.
स्टॉप शेयर कर दीजिए तब तक हम लोग डिस्कस करते हैं
नहीं सर
And
यही है
हाँ
those writers,
दिस इज व्हाट
this
इज
is the
प्लान
serials, but also radiologists and many artificial
दिस इज नॉट
systems
व्हाट
are
इज प्लान
precise in detection of early changes in medical imaging. So, but his
it is his voice.
recipe
बैक
is
करिए तो बहुत आगे चला गया
ओके
जीरो
ओके
with that, but
बहुत
just
आगे है
an
बैक कर लीजिए फ्रॉम स्टार्टिंग ना ठीक है यस
natural health.
यस
However, artificial intelligence is taking information from different databases
भाई
and
बहुत आगे जीरो पे ले जाइए बैक खींचिए एकदम
generating
अरे सर जीरो में 7 घंटे की वेबिनार है
अच्छा
उनका स्पीच यहाँ से ही शुरू है
अच्छा
which
अच्छा
are
ठीक
analyzed in amazing velocity, but still those texts are much less, much less containing some prominent ideas. It's just average level of information. But let's see what will happen in the future. Going to the healthcare, I think the surgeons and radiologists are two professions which are the most endangered currently. And you see one picture depicting how robots are doing surgery on you see the stomach of the patient. And surgeons are just staying on the right and watching. Probably they will need to intervene if something will go wrong. So we don't want to have such a future. Currently, there are some robots, the very simple ones, making cleaning, but could be very soon that we will do the cleaning part and they will manage that. So we don't want to have it. This is quite interesting graph from the Economist, journal Economist, and that depicts which professions are at danger currently. And the forecast is those people who are working in food preparation, construction, cleaning, driving, agriculture, garment manufacturing, service, sales, and customer service are the most endangered professions. Probably 50 of them could lose the job. So you see, healthcare is somehow not so endangered, and also hospitality and retail management and teaching as well. So what is the difference between the upper part of those professions and our profession, healthcare? So those in the upper part are working according to the algorithms. So the rules, how they do their job, are very much standardized. However, in healthcare and especially in teaching, it's not so. And what is the difference? Why we are more on the safe side? Yeah, this is another comment from Robert Scheer. He's American radiologist, and there is currently discussion also not only in Hollywood among those writers of the serials, but also radiologists, and you know, many artificial systems are much more precise in detection of early changes in medical imaging. So, but his recipe is not try to fight with that, but just embrace the artificial intelligence, because it will be good for your patients, because it will make you better, more efficient, happier, because if you don't do that, you will be replaced by other radiologists who will embrace artificial artificial intelligence. If you refuse to embrace, then you will be embraced by artificial intelligence. So there is no escape, Dr. Scheer is saying. What is the escape actually? Escape is the new way of thinking. And this is the one table from the Harvard Business Review Press paper by Roger Martin. And he compares two ways of successful thinking. And in the gray color, the first line is the way how traditionally people think, and which probably will be endangered by artificial intelligence, because they are focusing only on obviously relevant features. They consider only one way, and they are taking into account linear relationships between variables.
You want to stop share?
We break
No.
problems into the pieces.
It is sharing, no, sir?
Share the video.
Separately.
Open the video. PowerPoint is open.
Then they make either choices.
कहीं नीचे minimize हो गया होगा.
I would say that is also the traditional way how conventional medicine works. And you may understand that my next thesis will be that the Ayurveda and other complementary or integrative approaches of medicine have different approach to the human health and to the world generally. So we have to try to see less obvious but potentially relevant factors like Ayurveda, Vaidyas. We should consider multidirectional and non-linear relationship among variables. We should see problems on a whole, examining how the parts fit together and how decisions affect one another. And we should finally creatively resolve tensions among opposite ideas and generate innovative outcomes. So that is the way into the future of medicine. And in the center of healthcare systems should not be a body and even not mind, but the consciousness. And consciousness is that part which reacts to the environment and the way how we understand our world. So how to influence the consciousness? Consciousness is in the center of many circles, including the family, society, and finally the culture. And there were several observations before me how Indian culture and approach is different in different aspects, but I think we have to learn from Indian systems, traditional Indic sciences, because our institute is called International Institute for Indic Sciences in Riga, how really to deal with the new challenges in the rapidly transforming world. I don't know, should I tell you about Indian systems, but I will shortly go through it because it just confirms that the way of thinking is properly integrative, not conventional. So you know, all of you know Vata, Pitta, and Kapha doshas, and then it corresponds to changes in physical, mental, and emotional systems of the human, and yeah, I will finish in 1 minute, and yeah, it actually corresponds to the very ancient observations that also our whole environment, our whole world is a similar system, which has this triunity or trinity. And the physical state, the matter corresponds to Kapha, and the mental state more or less corresponds to Vata principle. And physiological state with a fluctuating and changing things very much corresponds to Pitta. So the same if we look at the three states of the mind, Tamas, Rajas, Sattva. And I will finish with this slide. So we are on the threshold when medicine will change. This is unavoidable. And the old medicine was more or less sick care. Now we are living in the final stage of current medicine, which is practically medical industry-based medicine. And the future medicine will be integrated medicine. Thank you so much.
Thank you very much. That was Professor Valdis who was speaking.
Yes, madam. So I hope our first session is complete with Dr. Valdis Pirags. And I would like to request Professor V.K. Agnihotri, sir, for his brief conclusion. In the meantime, I'm changing the stream link of our second webinar. That means, third webinar, that is scientific session first. I hope in the meantime, Dr. Shantala ji will open their videos, whatever have received, and we will play the messages. Or if that person is available directly, we will prefer to have direct message in comparison to videos. It is my humble request. Agnihotri.
Thank you, Professor Pawan Sharma ji. Thank you so much. And this was the inaugural session of today's international webinar. And we found that all the messages were there with the great dignities